Hey everybody, it's Celia Ward-Wallace from South LA Cafe. I am joined today with Marqueece Harris-Dawson. He is our CD8 Council District 8 Council member. He is joining me from his home. Looks like his couch in his home. And I am joining you from the Hustle Studio here at South LA Cafe. And so if you hear a little bit of an echo, it's because I'm in this great big room that we created for all of y'all to be here at. And right now it's just me. And Marqueece is at home taking the time out of his day where he's fighting the fight for Council District 8, South Central, as well as far as I'm concerned, really being a leader on the forefront of innovation of how to step up in a time of crisis. And a lot of the things we're going to talk about today are the innovative strategies that are coming up in this time of crisis of COVID-19 that his team is putting into place and hopefully is going to start to be repeated in all the other districts in Los Angeles. And from what I understand, your team is also being contacted by people from all over the country wanting to see what you guys are doing and how they can replicate what you're up to. So that being said, say hello to the people.
Hey there. Hey there, Celia. And big shout out to South LA Cafe and the South LA Cafe family. That's really been a beacon of hope and inspiration and struggle for South LA.
Thank you for that. Yeah, we are kindred spirits because we see ourselves as leaders in the community. We love our people and we are not going to back down in this time of crisis. We're going to step forward bravely, courageously, with hope and doing whatever we can. And so the intention of today's conversation, Marqueece and his team and us and other people in the community have been working together, honestly, for about 6 weeks at least now, in preparation for what we were seeing coming. And now we've just been weaving on a daily, literally, of what's happening, what can we do, what can we roll out, and who's being impacted, and how can we get the resources and support that everybody needs. So the intention for today's conversation is really to provide information, but also inspiration. It makes me feel comforted both to get information. I want to know what's happening so that I can ground myself in that. I can make a tactical plan. I can prepare my family and all those around me. And then I can also spread that information in the community and amplify it. But I also want some inspiration. I want to know that there's people out there that are fighting the good fight on my behalf. And so today the goal is when people listen into this, that they will get what they need to know, but they'll also get what they need to know on the soul level to be inspired and have some hope. And I know from the content that we've been putting out that people have really been so grateful that it has been activating inside themselves the question of, how can I do more? I may be on this shelter in place order, but even from my home, how can I do more? How can I be innovative? How can I be creative? How can I leverage the small following or the small circles that I have to make a greater impact? And so that would be the goal today, is that our conversation would ripple out and people would share it and pass the information along, and that as a community, and then ultimately a global community, that we would find more and more ways to be supporting each other during this time. So that being said, as much as I know you very well, and I can just say that, our families have been weaving for decades now. I come from a community organizing background, and my parents have a nonprofit in Los Angeles, a civil rights organization that has weaved with Community Coalition and yourself for many, many, many decades. And I actually Googled you the other day, and I pulled up a video of you on Oprah. And I was like, this brother's been in the game for a really, really long time. And has always been fighting for South Central. And that was about how we could improve our schools in our community, and really getting massive levels of funding that you were instrumental in securing for improving the schools. So that being said, before we jump into what we're doing right now in relation to COVID-19, can you just speak a little bit about your background, sort of your leadership philosophy, and anything that you want people to know in relationship to how you feel and relate to South Central in particular?
Well, I'm a son and grandson of South LA. Folks come out of the, great migration from the slave states to California. And I was kind of born in the cradle of both activism and opportunity that Los Angeles presented to our folks. And as I grew up, it was important for me to preserve that. And you saw that begin to slip away during my lifetime. And so I went away to Morehouse College, came back and got a job with a woman named Karen Bass, who was doing community organizing around the overconcentration of liquor stores in the community that we had all grown up with, and became an organizer there and really adopted two things there. One, a commitment to struggle and a commitment to spend my life in struggle to create a better reality and to create the opportunity to bring into existence the reality that our people deserve, but also a commitment, a method or a strategy of struggle, which is now referred to as community organizing, which basically the principle says that our greatest asset in any struggle is ourselves and our people. And to the extent that we can make connections, that we can build alliances, that we can bring our minds, our hearts, and our spirits together, that's what's going to give us the energy and the tools that we need to make the changes that we have to have right away. And so that's, kind of who I am and kind of how I end up on the LA City Council. Struggle, organizing and struggle has different venues. And so sometimes you're called on to serve in a different venue. Sometimes you're called on to have a coffee shop where the meeting of the minds can happen, and to do that at a place in a time that's super important and critical. And other times, when our movement grows to be large enough and civil rights organizations get strong enough, like the ones your family comes from, like the Community Coalition, when they get strong enough, sometimes it can send its own representatives into the government. And so that's the role that we're playing right now on the LA City Council. And we're trying to do our best, do what we can from where we are in that role. And so this crisis, again, puts us in contact with each other, just like it would if we were both playing different roles in the movement.
Well, I have to speak for myself, but I'm sure for others, Karen Bass is a legendary, beloved leader in our community. Right. And is rooted in the community, right? She may be in Washington, but then she's right back here at Albertsons, right, over on, King.
That's right, all the time.
You can catch her all the time, right? And similarly with you, you may be on the council at the meetings, making the big bills, but at the same time, you're hanging out at South LA Cafe, you're in the community. I see you guys all the time. And I take great pride and comfort in knowing that you guys have a community organizing background, because most community organizers that I know, the real deal community organizers know that, as my father, Eric Mann, would say, this is a long distance marathon. I'm a long distance runner. This is, something that you have to commit to for a lifetime. And so for people who are prior to this crisis that we're in now, I feel like as a country, especially since 2016, people have just started to really, really wake up to social justice or, community organizing, or questioning how they could be more involved or do more with the privilege and power that they have. And part of my conversation always with them has been like, that's phenomenal. And yet you have to realize this is a lifetime commitment. It is a privilege to be able to drop in and out and do a little something and then go back into your, safe, secure world. But the people who are on the front lines fighting the fight, whether it's in the council or whether it's in the strategy center or community coalition, those are people who have committed, honestly, their life to it. So that being said, I feel just comforted to know that we got Karen up there working on the stimulus package for us. And we got you here at the council, working on all the things that we're about to get into right now, the council's response to the COVID-19 crisis. Is there anything else about your background that you want us to know, or, you want to share anything else that we haven't covered?
No, I think those are the important things. I'm an LA kid and love all the things about this community, but most importantly, the people in it.
Absolutely. Me too. Yeah. South LA strong, love our people. Okay, so let's jump into part of the impetus for this conversation, although I know we would have got into a conversation like this one way or the other, has been about the midst of the crisis that we're in right now with COVID-19, which, just to be clear, is the same thing as the coronavirus. Whenever I do content and conversations, it's really important for me to take these macro level sort of complicated concepts and find ways to break them down into bite-sized, digestible, information that people can take right now, because not everybody's at the same level of understanding of these things. And so my goal is that you and I will just have a conversation as if we're talking to our children, or some of our high school students at Dorsey or Manual, who they too are trying to understand what's happening, or some of our community members who are undocumented, who may be getting this information translated from their, teenage kids, or the seniors, that maybe are not comfortable with technology, but somehow are going to get to hear the audio of this or catch the video of this. So I really want to make sure that we approach this both in that we're giving all the information that we need, but we're also not keeping it so high level and insider that people can't actually access it. And I know that's something you're good for, is just, keeping it real. So that's the approach. So when we talked about what to cover for today, your team sent over to me basically an outline of many different aspects of what in particular the city council is working on right now to respond to COVID-19. And I know some of these things are in the works, and some of these things have already been done. I have outlined certain categories that I'd love for us to touch upon. If there are other things that you want to weave in or that we haven't talked about, because you do have quite a lot, it's a very comprehensive plan you guys have put in place. Feel free to add any of those things in. But I wanted to start with small businesses, but maybe let's just start with renters, because I feel like that's, the everyday person right now in our community. Not most, but many people are renters right now. I have employees that, right now are saying, what should I do? I have to pay my rent. And so what is this moratorium on eviction for renters? Can you tell us a little bit more about that?
So let me start by saying, on the legislative side, there are essentially 4 levels of government that we are all sort of subject to when it comes to things like housing. There's the city government, there's the county, there's the executive, which is the mayor in our case for the city of Los Angeles, and then there's the state of California. On the eviction prevention and the eviction moratorium, we're lucky in LA because all 4 levels of government have put forward an eviction moratorium. The LA City Council has, the county has, the mayor has, and the mayor can do it without even getting a vote. Once an emergency is declared, the mayor has that authority. Our mayor has asserted that authority. So has the governor. So folks are covered on rent. Here's what I'd say about rent, though, just to keep it 100, as they say. If you can pay your rent, pay it. Because what we're doing is an eviction moratorium. We're not doing a rent moratorium. So for instance, what we put forward in the city that will kick in once the mayor's emergency authority expires, which it will expire at some point, we said people have to be given up to 6 months to make up for the month during the crisis, right? So if there's a way you can not get behind, I encourage you to do that. But if for any reason you have to get behind, understand that you won't be evicted. Once we get through this, you'll have it 6 months, somewhere between 3 and 6 months, to come up with a payment plan. Your landlord will be required to make a payment plan with you so you can catch up. But it's not as if your rent's going to go away. It's just the threat of eviction goes away while we're in this crisis.
I think it's an important point because, we'll talk a little bit about it, but obviously, Joe and myself at South LA Cafe, we're homeowners, so we have a mortgage. We are leasing this space here for our cafe, and so we have rent. We also very luckily have a couple rental properties, income properties, and we have tenants. who are going to struggle to pay their rent, right? So we're looking at it from all of the angles of how this is going to impact us. And it does feel, I think for most people, regardless of whether they have all those things going on, it does feel like a bit of a chess game right now, because we're in so much of an unknown period of time. We don't know how long this is going to go on. We don't know who's going to get sick. We don't know what the expenses are going to be. And so I think it's a little bit of a, I don't want to say a catch-22, but it's like one philosophy, just, you know, from my perspective, one philosophy is either pay what you can, like if you have, you know, some of it, pay what you can, and then, you know, obviously to keep good records of what you've paid, even if it's a partial payment, or if you can pay your full rent, pay it, because by doing that, the benefit with that is, down the line, you won't be hit with, now you owe 6 months rent and now you have to figure out a payment plan and you have to add that on top of whatever it is that you're already paying, right? Because that essentially becomes a greater burden down the line. So it's more of like, do you want to have more relief now and potentially have a more stress and burden down the line? Or the alternative is, you know, even holding the money, you know, even if you had the money, well, I guess the point is, if you have the money, you're supposed to pay. And I totally get that on the ethical front. But at the same time, if we're keeping it 100, you know, people are afraid, they don't know what's going to happen. So they're like, well, if I pay all my cash to my landlord, great, he can pay his mortgage. But what if my kid gets sick, or what if my grandma gets sick, or, you know, what if I can't find the grocery, you know, like people right now, I know their minds are just racing because we feel so uncertain of what's going to happen. And so I think for me, the way that I would interpret what you're saying is, if you cannot pay your rent right now, don't stress out about that. They cannot evict you. That's the most important thing. So that's
the most important thing. And that's the thing that's for sure.
That's the thing that's for sure. And then the rest of it is sort of about you making a decision, I guess, that's best for your family. And it's going to be different in every situation. But the main thing is you won't be kicked out of your home in this time of crisis.
Right. And we're very far away from there being a rent holiday. So, you know, like that's just not, or rent freeze. Like, actually, I take that back. There is a rent freeze. So so your rent can't be increased during that time period. But there won't be a rent moratorium. Like you're gonna
have to pay that rent as one point in time. Yeah, which is very important, because I remember from the 2008 crash, which as serial business owners and entrepreneurs that Joe and I are, and we've been in business, social entrepreneurship for 25 years, and we were in real estate as one of our past businesses. And I just remember at that time, we received very bad advice, because there was so much advice going around at that time around this, you know, follow this loan modification process, right? Which basically told people, don't pay your rent, and try and work with the mortgages on restructuring your loan. But what we found that people had not made clear to us is that you better make sure you're saving every single dollar of what you were supposed to pay, because if you can't qualify, or if it doesn't go through, they basically would say you owe all that money right now. And so not just for us, but for many, that was a result that resulted in foreclosure on properties. And it did for us as well. And so I would just say, as a memory of those times of what happens when you make these decisions, that you can come, you know, right now we're in the midst of this health crisis, but it is going to end up being an ongoing economic impact. And so you really need to make sure that you're setting yourself up, you know, in my mind, with a plan for the next year, and a strategy. And so I'm grateful that we're talking about it, because it sounds like there's a lot of different moving pieces to it.
There are, and there's gonna, you know, there will be some mortgage. There will be a similar thing on foreclosures. There will be, so far, all of the banks, except for Bank of America, make sure you say that really loud, except for Bank of America, all of the mortgage companies have agreed to suspend late fees, and have agreed to not take people into the foreclosure process. State of California is putting, again, a temporary moratorium on mortgages. So the government is very much just like your family in that they're reacting to the information as they get it.
Yeah.
But what the public is getting, at least where I'm sitting in the government, what the public is getting is not much less than what the decision makers are getting.
Okay. So I think that's a good point. So also, if you have mortgages, keep that in mind, that it sounds like what you're saying is there, and we've already done this on our front, is at least called our mortgage company and had a conversation with them and, started to figure out, well, what are the options? And so if you are a homeowner and you have a mortgage, please make sure that you do that as well. And in my experience, again, after going through the big, crash and recession, you want to make sure you keep really good records. So make sure you know who you talked to, what exactly the arrangement was, and that you have that all in place. And so now as we transition into moratorium on evictions for small businesses, I'm presuming it's somewhat the same situation. Although this one I have a little bit of a challenge with. I mean, I guess you have a challenge across the board with all of this, because it's very hard. I understand that ultimately you may end up needing to pay for these things, but if you don't have any money coming in, it's hard to so-called save the money to be able to pay, down the line. But is there any differences in the moratorium on evictions for small businesses?
So far that I know of, there are not any differences. I mean, you should pay real close attention to what's happening in the federal bill, because the federal bill will help take care of some of this. But there is some work that we're going to have to do at the local level and at the state level to figure it out. I mean, what's good is, there's definitely now the business owners and the landowners are in different class structures, where normally in our politics, they're on the same side of every issue. Now they're on different sides of it. So I think, moving small businesses into the category with workers and poor people and everybody else, I think gives them tremendous leverage. And I think we'll come up with something that is protective of small businesses. Because here's the thing about the landowners. It's not as if, especially in South LA, it's not as if your landlord can go find another coffee shop to replace you right now.
Right.
Because no coffee shop's going to make a new lease. So it's not a real advantage to anybody to be trying to punish people for being victims to the crisis.
Right, for sure. I totally get that. And I guess what I was just thinking is, given what you're saying about making sure you save your money for ultimately, Joe's trying to make an appearance here. Here you go. Joe's
got a mask.
Joe's got a mask and gloves. We keeping it very healthy and safe here in South LA Cafe. Otherwise, there's no way we're going to get to keep doing what we're doing. So
yeah, that's true.
We've implemented extremely strict protocols here, which I think in general people are feeling really happy about. Because if we're asking people to come out of their home and even do curbside pickup, if it were me, I'd want to see the person I'm getting the stuff from, that they have a mask and gloves on, and that they're sanitizing everything. So yeah, we're keeping it really high level here. But let me just say on that front, I did do a Instagram live that I actually shared on our South LA Cafe Instagram page that I know some people have been sharing. Soon in the next few days, I'll also upload it to our YouTube page. So that's sometimes more easily shared, where I did go through our personal process of applying for the SBA disaster relief loan.
Oh, good. Good.
And so I just want to say, for people that are small business owners like us, and I know part of what we'll talk about is sort of some of the things that we're doing for small business owners, that my philosophy has been, apply for everything right now, try to get the money right now. Not to be irresponsible, but just sort of feeling like, if these things are being offered, if they're available, you should go ahead and try and apply for them. Because what I'm understanding is people want to see when you're applying for these relief loans. And I know the city has also a micro loan that's available as well. And I've also seen some of the local nonprofits are putting out loan programs as well, relief loan programs. The goal is we want to keep our small businesses afloat during this time. so that when we get to the other side and everybody can come out of their doors, that, you know, we can open right back up and, you know, be ready to go, and that we won't have been so damaged economically during this time that people will have to be filing for bankruptcy or closing down businesses completely. And so we went ahead and applied, and we're still in the process. We haven't gotten approved, but we did outline sort of who should do it, how to do it, what are the tricks, what are the things to know. And one of the things that I will just say here is, and I think you'll agree with this, is when you actually talk to anybody at the bank or when you're writing anything, you want to be able to say, you know, look, we intend to make it through. We plan to reopen. We're already working on strategies right now to do what I'm calling the great pivot, you know, like, you know, where we're going may be completely different from where we came, but we're ready to, you know, do what we have to do to evolve and adapt to a changing environment. And our business wants to continue to be open, and we want to continue to employ people. And so what you don't want to say is, our business is shutting down, we've had to lay every single person off, and we're going to close up shop for good, and we don't have any money to support ourselves. Those are not the kind of applicants that I'm hearing they're wanting to give money to, because they want to know that you're going to have a business, that you want to have a business, and that you have a plan to open up your business again when this is all over. Does that sound resonant to you?
That's totally resonant. And I think that has to be your strategic approach to the whole thing. One thing I will add that's material to what you just said is, I know from tracking the bill in Washington, part of the attachment, and it's the left of the Democratic Party that did this, part of the attachment on the small business loans is going to be that you don't fire any employee, that you furlough them. And you furlough them, they'll collect unemployment. But the understanding is, if you take this loan, we expect you to set your business back up, to bring all your people back, and to continue the economic activity that you were doing before the virus hit. And so that's completely consistent with the
right. And so, and just to be clear on our front, we have had to lay off employees. What we said to them is, this is a temporary layoff. The reason that we're doing it is because our revenue and the current health crisis is unpredictable, and we can't guarantee your income right now. And we want to make sure that you are as protected as possible. And so if there are benefits available to you, we want you to apply for them. And yet we may have more hours even through all of this. You know, we are having, what we're trying to do is sort of follow a sort of like a firefighter schedule, you know, like work one full week and then take 3 weeks off. And our goal is to really be trying to keep the health and safety at the highest level. So we want to make sure that we're tracking all of our employees. Anybody who's sick is not coming in, and then they have to go on quarantine for a certain period of time and all of that. But what we've told them is, we may call, you know, you're essentially on call still. And so we'll contact you. You can come in, and then if you do work hours, then you report that to unemployment, and then that will adjust, you know, what your benefit is. But for the interim, we want to make sure that we're protecting our people, and that we do have. And so essentially, it is a furlough, and we have every intention of bringing them back as soon as we can. And we have every intention here at South LA Cafe of not going anywhere through the entire time. And part of that is why we're doing this interview with you is, you know, as you know, we've been creating amazing content in person in this space, and we've been building such a tight-knit, thriving community here. And it felt very sad when everybody had to go into their homes. And what we realized was everybody's at home, but they still need us. They still need each other. They still need to feel like there's a web, a safety net. And so we're just going to go find them where they're at. And so we've just upped our online content. We've upped our social media engagement. And our goal is to just keep having conversations after conversations and bringing more and more content that could serve people in their homes until we can get them back in here. And we're already planning our great grand opening party.
Excellent.
Which you were at our original grand opening. So
yes.
we'll have you back at that time too. Let's jump into the coronavirus testing. I'm really curious about that one. I feel like I'm very unaware of what's going on with that. How does that work?
Let me start by saying this. I don't know.
Okay.
So I'll tell you the information I've been given.
Okay.
How about that? The information I've been given is that testing is ramping up. Every day we're adding more testing capacity in California and in the United States. And you can see that, the evidence of that, because we have so many more new cases every day. But there will never be testing, and no one is pursuing testing that's consumer-based. What do I mean by consumer-based? That is, I want a test, I can go to this place, pay $5 and get a test, or pay nothing and get a test. They're not moving towards that. What they're moving towards is, which is troubling in a way. What they're moving towards is, right now you go into a clinic, a community clinic or a hospital, and you have symptoms. The hospital or the medical professional will make an assessment. Okay, you're 25, you're really healthy. I think that you might have the virus, but you're not going to get very sick. So I'm just going to send you home and tell you to quarantine voluntarily. And cross our fingers, one, that you get well, and two, that you don't infect anybody else, which are really big ifs. If you don't get well, you get sicker, they presume you'll come back to the hospital or the emergency room.
Yeah.
And then they'll test you, and then they'll hospitalize you if needed. So the only way to get testing, as far as I know now, although I know this is not true because the NBA has tested all its players, but the only way for everyday people like us to get testing is to go to a doctor or a medical professional and say, have symptoms. That person will send you for a test or have a test done on you, and you'll get a result a day later. We have a testing site in South LA. It's at Vermont and 76 at Crenshaw Christian Center. But its appointments it's by appointment only. And as far as yesterday, they were booked through Friday. So I don't know what it is today. Exactly. And this, again, mind you, this is only people that are being sent there by a medical professional.
Okay, that's helpful. I missed that thread. So let me just roll it on back again. I'm not going to say it's me because I don't want to claim it for myself, but let's say a hypothetical person is home. They think that they're having symptoms of coronavirus. My understanding, and again, you're not a health professional, nor am I. We don't have a health professional on this call, so I don't take what we're saying and run with it. And yet at the same time, I sort of feel like it's our duty to share what we sort of think we know. And so from what I've been studying, my understanding is, and you tell me if I'm wrong, unless you're in a so-called at-risk sector, which is a lot of different people, right? And so that in itself gets complicated. But you basically, if you have an onset of symptoms, which are multiple different kinds of things, but I do know that it's a low-grade fever, cough, headaches, and the main one that I'm hearing is most concerning is shortness of breath, right? Inability to breathe. But if you don't have shortness of breath, my understanding in general was the goal is that you would quarantine yourself at home in your own room, presuming you are not living with your entire family, and basically ride it out. I do know people right now who believe that they have the virus. They're not in Los Angeles, but friends of mine, and they're on day 11 of their quarantine at home journey with what they're pretty much sure is the coronavirus. And so part of, I know what for myself and for others, the question mark has been, well, is it really beneficial for me to leave my house, go to a doctor where there's all kinds of people all around that probably have germs and who knows what I'm getting, for them to just tell me to go back home and self-quarantine versus wait until, not wait, but only pursue medical treatment outside of my home if it feels emergent, if it feels like I can breathe kind of thing.
So what health professionals have said to us is a person should come to a medical facility when the treatment is beyond their capacity.
Okay.
So if you can't breathe, that's something you need some help with, right?
Yeah.
Like if your fever is like so hot that you can't function,
yeah,
then you need an intervention. But if the symptoms are such that you can treat, and especially you pointed out shortness of breath. Obviously, if you have shortness of breath, show up to a doctor.
Yeah.
But headache, stomach ache, even a mild temperature, those are things you can treat yourself. And we do it all the time. We, orange juice and echinacea tea and ginger and, hot baths or cold showers or whatever it is.
Yeah.
If you can treat it yourself, treat it when you can't come to a medical facility.
Right. So, and just to reiterate, essentially, if you were to get the regular flu, right, that has been going all around, a lot of times you would just stay at home for a week or 2 or 3
Yep.
because you're just really darn sick, and
Exactly.
you knew that you had the flu. Part of what I'm seeing also is cropping up. It appears, and I don't know if you have any resources on this, or maybe if you can let me know after. It does seem like there's a lot of online appointments available, different clinics, different doctors. And if it were me and my household, I would first be trying to get, a face-to-face or a phone conversation with the doctor before I would ever go into the doctor's office, unless it was an emergency, right?
I think that's right. Although I will tell you that the clinics and the doctor's offices that I have seen are doing a really good job keeping people apart from each other and making sure their workers have the kind of equipment that they can't pass it on, and not letting people touch surfaces and washing down. It's actually been really impressive. So if you have to go, I wouldn't worry about it. But I do think it's important to encourage people, if you have an ongoing condition, like I have a relative that had a doctor's appointment for hypertension. We advised them, call your doctor and see if you can do that appointment by FaceTime.
Yeah.
Just so you don't leave, because every time you leave the house, the risk that you're going to come in contact with someone or some surface is so high that you can't really guarantee that you won't come in contact with it. So to the extent that you can stay in, stay in. So if you have symptoms that you can treat them. If you have doctor's appointments, see if your doctor will be willing to see you by hypertension. A lot of times all the doctor's doing is looking at test results.
Yeah.
And having a conversation with you, which they can be done online.
And it sounds like what you're saying, though, is if you do feel very strongly that you have coronavirus and your symptoms are very extreme, then you would want to go in and see a doctor, and you wouldn't be able to get tested until you've gone in and seen the doctor, and then the doctor is going to refer you to a testing facility. Is that correct? Okay. And it sounds like by appointment only.
By appointment only, right.
Okay. And I just want to speak to this issue too. While we're at it, you and I had talked a little bit about the shelter in place, and to whatever extent you feel like there's anything about that you want to discuss, because I do feel concerned that in our community, but it looks like if you look at the news, it's, all over the country, all over other countries, people are not really taking this shelter in place order seriously, or maybe don't understand it, to give them benefit of the doubt. It does seem like a lot of the youth in particular, somehow got the memo, like, I can't catch this virus, and if I do, I'm going to be fine, so I should just go about my life normally. But my concern is that they're living in homes where their grandma lives there. And they don't realize that they can be a carrier. Even if they have very, very mild symptoms, they could be a carrier and put their family at risk. And so can you speak to any of those pieces about the shelter in place order?
I think the shelter in place is so important because it's the aspect of being a carrier. In my business, you shake a lot of hands, you hug a lot of people, you're around a lot of big crowds. I assume that I'm carrying the virus. So what does that mean? It means I don't go around anybody that is in the risk categories at all.
Yeah.
And when I do go out, I take all the safety precautions. So I think that the shelter in place is a very serious thing. If there's any way that you can stay home, do that.
Right.
And if you have to go out, make sure, like when I have to leave the house, I make sure I do everything that I have to do on that one trip, so I'm not in and out. And I try to be very cautious about what I'm doing. I mean, just even when you have to go to the grocery store, again, the grocery stores are doing a great job. They're only allowing about 30, 40 people in, depending on their size at one time. But you still walking down a grocery aisle. I walked down a grocery aisle and I got a tick in my throat. I was like running down to the other end of the aisle to cough because I didn't want to scare the other person that was on the row. So, and there was nothing wrong with me at all. I just, but that's how serious it is. So I think, again, shelter, everybody, even if you're not sick, that doesn't mean you don't have it. That's what's really
exactly. And this has been my thing is from what I understand, you could have been in contact with it 7 days ago, 10 days ago, and you could be carrying it right now. And what they say is usually the first week of exposure, you don't have symptoms, and it's when you're the most contagious. And what I've been telling Joe and all the staff here and everybody is just walk in the world as though you presume everybody, including yourself, has this virus. And so how would you be if you knew that, you could be passing this along anywhere you go, or anybody that you're coming in contact could be passing it along? And so just to say, in terms of my understanding is we are all supposed to be at home unless we are doing an essential service of job. And so if you are in a food service industry, if you are in a health service industry, if you are in a political government industry, then I think there's some, doctors, firefighters, and police officers, those kind of people. But in general, every single other person's supposed to be at home all the time, unless you're leaving to get food or medicine or, a government support service or something like that, right? Is that basically it?
That's right. That's totally right.
And even at home, you guys, I just got to say, I may be taking it a little bit extreme, but I know we have a business here that we're trying to keep going and serving the community. But like, I'm not even, I'm trying to social distance at home, right? I'm not even really like kissing my husband these days. I'm just like, I don't know what you have. I'm trying to stay healthy. You're trying to stay healthy. We need all of us to be staying healthy. So I'm not going to tell you don't snuggle up with your kids, but at the same time, just keep that consciousness when you're in your home, and a lot of our community live with a lot of people. A lot of people have multi-generational households, right? And that's something that is so important to just keep in mind about how you're even spreading it in your own home. So make sure you're sanitizing. I heard you're supposed to wash your hands, for, what did they say, 2 times the happy birthday song, and make sure you're getting suds on your hands, because that gets into all the crevices of your nails and your rings and your everything. And make sure that if you're coughing into your sleeve, but then you have to know that you probably need to take that shirt off and put it in the washer and then wash your hands, right? It is making us all so OCD germ sensitive. I heard someone say we might be raising a new generation of, hypersensitive germaphobes, but we are learning a lot, right? Okay, so thanks for the shelter in place. And the last thing I want to say is, and if you're going outside, what I've noticed is people are going outside because that's the only place to go. But if you're walking down the street, you gotta do the social distancing as well, right? Yes. So, if you're walking with someone, you're supposed to be 6 feet away. If you're walking by people, you're supposed to be at least 6 feet away. And so just keep that in mind in terms of the way you're moving in the world. Because I notice when I'm out walking my dog, there might be like 14 people out walking their dog, and we're all trying to figure out how to navigate that, right? And what's funny, and one of the questions that later we're going to talk about as we wrap up is, how is this bringing the community together? But I do have to say some of the funniest and most connective moments have been out on the street, where we're trying to social distance, but we're also trying to like say hi to our neighbor and check in with them and all that stuff. Let's jump into what's going on for homeless. I mean, the homeless folks, we already know that LA has a homeless epidemic. And I know you've been on the forefront of, working on that. We obviously in South Central, this has been a huge issue for us. A lot of our population here ends up on Skid Row as well. Skid Row, has a huge concentration of African-American people, in particular African-American men. And so we're thinking about this every day. What can you tell us about that?
Well, the homeless situation is tricky, and we're throwing a lot of resources at it. So for people that are in the categories that put them at high risk, we actually have a glut of hotel rooms. Our biggest hotels in the city of LA right now are at single digit occupancy, like 7,
Right.
6%.
Right.
So between the county and the state, we've worked out a deal where we can get hotel rooms for people that are at the greatest risk.
Amazing.
We've also opened up rec centers as shelters.
Mm-hmm.
Now, what's tricky is a rec center that could normally hold 100 people, you can only put 30 people in because
Right.
you got to keep the distance, right?
Right.
So that's a tricky one. So we have a lot of those shelters, temporary shelters now, but each of the capacity of each of them is very, very low. But the CDC issued guidance a couple of days ago that said homeless encampments should not be moved and people should not be moved from them. What the government should do is clean them and leave them potable water and cleaning materials so that they can clean themselves. Because every time you move them, you increase
Right.
the chances of moving the virus
That's
around.
interesting.
So LA County is still figuring out how to react to that because our county health system said the best thing to do with homeless people was to remove the condition of homelessness to get them into shelter. And the federal government has come out with the opposite guidance. The truth is, I don't think anybody really knows because no one's faced this before. But we're trying to fight on all fronts. So what I would say about that is this: if you're on the street or you know someone on the street and they want to get shelter, they can get shelter right now. There's more shelter available now that's been available in the last 10 years.
How do we get them to that?
They just call LAHSA or the LA Homelessness Services Authority. In South LA, the organization is called HOPICS, HOPICS. Or you can go to any park, and if there's staff at the park will let you know as well how to get, because all of our shelters are in rec centers at our park. So that's what's happening on homelessness. I know the public health officials are paying really close attention because everybody's worried. Everybody's nightmare is Skid Row is like a petri dish, right?
Yeah.
It's almost like a lab that's built to create crisis. So they're watching very closely to see the folks that come in to see if they're seeing it on the streets. I imagine when that happens, if that happens, it'll be a big reaction. Here's the other thing I'd say about the homelessness. And again, not a medical professional, no public health training at all. But here is the fact about homelessness, and this has been true for 5 years. We lose about 7 or 8 people every night on the street of natural causes, which means no one killed them. They didn't have an accident. They just didn't wake up the next morning. So we actually don't know what's out there and what's been out there, what the trends are with sort of who's ending up with this sort of homelessness sudden death syndrome.
That's deep. Yeah. And I imagine on all of these issues, and there's so many that we're not even going to get a chance to touch upon, I'm obviously there's a whole thing with the Reform LA Jails folks that are working on what we're doing with our incarcerated population, which if we're not even going to get a chance to touch upon that, but definitely there's groundbreaking work being done right now to fight for the people in the prison and jail system. So I would definitely check them out. But I'm just imagining as this is all unfolding that, in the years to come, this is such fertile ground for so much study. And honestly, I feel like massive transformation, right? This has been, I've been talking about this great pivot in terms of this is, we have the Great Depression, we have the Great Recession, and it seems like one of the sort of survival strategies right now is how are we going to do this great pivot? Like, what we had before is gone and where we're going, we don't know. And every day we're having to make these shifts and be innovative. And I think there's just so much creativity that's coming out of this, it really in a sense of a state of emergency, this sense of urgency of like, we have to figure out something right now. And so it's like at the same time, there's this massive, massive crisis and so much in many ways darkness, I also feel like there's been a lot of light and creativity and, evolution, and people, are just seeing things that they never saw before. We're finally talking in ways we've never talked about these issues, with a sense of urgency of like, hey, people like you and me and the people who have been working on these issues for decades and centuries, we've been talking about this stuff forever. We knew that these were the weaknesses in the system, and that all it was going to take was something like this to break. But I feel like people are finally waking up and seeing it for themselves. And I think that there will be so much work done retroactively studying that. One of the great pivots that your office in particular has been spearheading, that we have been very fortunate to be collaborating with you on, is this emergency senior meal program and that has been in collaboration with both feeding the seniors and allowing them to stay in their homes and not have to come out and be at risk for getting food, but also has been supporting and putting revenue back into the small businesses that serve food in the community, as a way for them to have this partnership and get funded by the city departments. Can you speak to that a little bit, and maybe like where that even came from, what you guys are doing, how is it being potentially replicated?
Well, this is one of the advantages to coming to this work as a community organizer, because kind of in the community what's happening and who's going to be vulnerable. And we knew two categories popped on us high in the list. Got a lot of people own their own homes. They struggle with mortgage, but we know that there's a way to get help to them in enough time. We know we have a lot of public sector workers who are going to need childcare, but we figured that there was a way to deal with that legislatively. And it looks like that's going to occur, because those people still have to go to work and they can't send their kids to school. But the two categories of folks that we thought had vulnerability that wasn't likely to be addressed were seniors, because seniors who get food on a regular basis, who feed themselves, now suddenly it's a big risk for them to go to the restaurant, even to do pickup, or to a grocery store. And my understanding is 65 and older has been told you need to stay inside, not even come out to get food, right? You need to stay inside, but not coming out. But I will tell you, we passed a motion on City Council asking all grocery stores to open up their first hour for seniors, and the grocery store is full.
Okay.
So there's still a number of people that are feeding themselves. But to those who made the decision that they were going to stay indoors, we wanted to take the issue of food availability away from them. And, South LA has been a food desert. We've got all these new food businesses. There's like a renaissance of Black coffee shops. I know. Like a lot of great restaurants vegan restaurants,
healthy restaurants. I mean, we had this beautiful collective happening that we were all just so excited about.
And when businesses are new, as you know, because you've been in lots of businesses, including this one, when businesses are new, they can't afford bumps. Like bumps are not, you got to be on a hyperdrive.
We were just ramping up.
Yeah, right. You got to be in hyperdrive the first 3 to 5 years, before the business becomes, sustainable, where it kind of works on its own. And so we said we had some money for events. We have Our Pride, which we had to cancel. We have a big Mother's Day celebration with about 5,000 mothers in the district that we had to cancel. So we said those resources are still there. Let's sweep those resources and use them to get meals delivered to seniors, and let's give those contracts to our local small businesses, our food businesses. And so South LA Cafe stepped up, and probably everybody in your collective have stepped up. And so it's great for a few reasons. One, it gives the opportunity for the businesses to have some steady income at a time when they have to be closed. Two, it puts seniors in contact with businesses in their own neighborhood that they may not have known about or come to or anything like that. And so suddenly you have seniors getting food from like, where's this place? This is so amazing. As soon as this is over, I'm going to go eat there.
Yeah,
so
great point.
Businesses to have an opportunity to build a new customer base, and a frankly pretty reliable customer base. And we make sure people get their nutrition and understand that there's food in their neighborhood. And so I think, seniors are some of the best customers for small businesses, especially food businesses. But seniors are some of the hardest customers to get, because once they get their 2 or 3 places that they go,
right, they're set in their way.
yeah, they'll walk right by a new business and not even think about going in. And this gives an opportunity to expose new businesses to that customer base. And so we're very excited about it. There are 18 restaurants participating. We're going to be up to 1,000 seniors on Friday. We'll probably get to 5,000 by the end of next week. So it's just been very exciting. The phone calls that we've been getting, the stuff on social media, we feel like it really hit the right note in terms of, one, giving some people something to do. And again, the community organizing principle. You connect the people that are already there on the ground. If they get connected, they can figure out how to survive in ways that decision makers in some room downtown can never figure out.
Well, one thing I just want to say is your team, we just recorded a great, testimonial video for your campaign. And, you must not have even seen it yet, but your team, that's what I'm trying to say. Your team, you have this amazing team. They patronize us all the time in the cafe. But also we built really great relationships with them. And like I said, we were calling them 6 weeks ago saying, this is what we see is coming. What do you guys got planned? How can we collaborate? How can we support what you got going? And then they have just, been on fire with this. And I just feel very proud for you and proud for us to be associated with it. And for whatever way you were able to actually make it happen. Because I think that's, the everyday person who's not in politics has a lot of, feelings about politicians and how it's like so much talk and no action. And, the money is going to the big people and it's not reaching the regular people. And somehow you guys figured out to be creative and innovative about how to get the funding, how quickly to get it approved, how to release it. I mean, we have actually gotten paid already for the work we're going to do.
Wow. Okay.
Yeah. They're working on how this is going to continue. But then that allowed us to bring on a chef specifically for this specific program that is a vegan chef, African-American woman from the community that we were already collaborating on menu items for the cafe. And this was a great opportunity for us to say, hey, we know you may need additional revenue also. Let's collaborate on this together, create a menu together, work together, and then we can pay her in addition to us being able to bring in additional revenue to the cafe. So it's been amazing. And I'm getting calls all the time now, though. People are like, how can my mom get a meal? Can you donate this? I need meals. Da, 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 da. And so I do know, I hope it's okay to just say foreshadowing, I do know you guys are also working on some even bigger ideas about how to make this more widespread so that we can not only be serving the people in the homes that we already are, but trying to find ways to actually reach individuals in their homes.
Well, next week we will be doing individuals in their homes.
Right.
So next week we'll continue with the senior housing facilities, because you have dozens of people living at one address. But next week we will start doing the individual addresses. And so DoorDash has joined us. Lyft looks like they're going to cut a deal so that we can get them to get drivers that live in South LA.
Yeah.
And we can get a very, very reduced rate. So those drivers can get paid.
Amazing.
They can keep working. They can be serving their neighbors, and the restaurants can be in the chain. But it's going to take a lot of people and a lot of cars, which is why a lot of people and a lot of connections to make this work, which is exactly why we like it, right?
Right.
We think the more our people are connected to each other, talking to each other, interacting with each other, the stronger we all are.
Exactly. Well, if people want to know in the future how they can get a meal, if they're a senior, will you provide information? Is there going to be a list? How are you going to figure that out?
So there's going to be a list right now. We are prioritizing, because I'm using public funds, we're prioritizing residents of the district. So
Sure.
We actually have a list. If you're registered to
you already know.
Yeah, we're calling you.
Okay, great.
So that's what we're doing. So I have staff that's all they're doing all day is calling me, say, hey, Ms. Thomas, do you need a meal?
Great.
Meals from this restaurant. She says she might say no, but my neighbor.
Yes.
And we say, okay. So that's kind of how we're doing it now. So it's only outreach. It's not really in reach.
Yeah. That's great.
We'll probably get to in reach in a couple weeks.
So if people ask me and they're part of CD8, then I should tell them, make sure they pick up their phone because someone from your office is likely trying to reach them to figure out if they need a meal, if they're a senior.
Or they can call my office.
Okay. And then
you might get a machine, but leave a message.
Leave a message.
Contact info, and we'll get back to you.
Okay. Is there a number for your office?
323-473-7008.
Okay. And on this meal program, though, what I'm understanding is other districts are also trying to learn what you guys are doing so that they can replicate it.
Yeah, other districts are trying to replicate it because they have the same issues, right? They have one council member said to me, he's like, I know there are probably 1,000 people in my district who don't know how to turn on their stove.
Yeah, exactly.
And it's very real. And they've all got the same situation in a way more than we do. Because South LA has so few businesses that we've actually been able to touch everyone that wants to be touched. In other districts, they have so many small businesses, they're not going to be able to do that. They're going to have to pick and choose which ones they do. But I think, down in the harbor and in the Watts Willowbrook area, folks are looking at it. Folks are obviously looking at it in the other South LA council districts, and then a couple in the Valley as well.
Okay, great. I'm mindful of your time. I know you got to get to leading the county and the city and our neighborhood, but I just want to ask you a few last things. How important is self-care in this time? What does that mean to you? And what are you actually doing? We want to know how you're taking care of yourself.
Well, self-care is super, super important during this time period because we are human beings. We are wired to want to be together. And we're wired to want to take action when we have a problem, right? So when you're confronted with a problem, you can study the physiology of the human body, like the chemicals in your body go into motion.
Right.
This problem, you really can't do anything. Really, you just kind of sit home. And so I think it's, whatever things that bring you energy, if it's music, if it's exercise, figure out a way to get those things in. I've cooked dinner for my wife more times in the last 2 weeks than I have probably in the last 5 or 10 years.
I know she's loving this right now. She's getting to see you more than ever.
Yeah, I'm like.
Or maybe not. Maybe she's ready for you to go.
No, she's loving it. It hasn't gotten to the point where she's tired of it yet. But taking these opportunities, I asked myself, what would I do if I was on a month-long staycation?
Mm-hmm.
And then we just try to make a list and make sure you do those things. But I also think it's important to stay connected. Make a phone list. Make sure you discipline yourself and you call 5 or 6 people and actually talk to them, people that are important to you every day. So you maintain the human connection. But again, it's a great time to invest in yourself. Mm-hmm. You want to learn piano. I mean, we got YouTube. You want to learn piano. You want to learn basket weaving. You want to learn kite making. Just look it up on YouTube and you can discipline yourself to do it.
Exactly. And also get a lot of sleep. This is an opportunity to sleep, right? That's one of the best things we can do for our immune system. So I know you're a big music lover. What are you listening to these days?
I'm listening to all kinds of stuff. I had an Intervisions, Stevie Wonder Intervisions album day the other day. I've been trying to post what I'm reading and what I'm listening to. Last night it was Sabrina Claudio that we listened to. Before that it was Cameo and Cameo's Greatest Hits. I'm very excited because South LA's own Terrace Martin is releasing a album tomorrow called Soul Juice. It'll be on all the streaming services. So Terrace Martin, on the 27th, will have a release. So we're very excited about that.
Make sure to share that info with us and we'll put that out so everybody can see where to find that. So just one more question I have for you. And while I ask you, I'm also going to just look at our Instagram stories because I did post asking people if they had any questions for you. And I want to make sure that I'm making sure I didn't miss anything here. But in the meantime, my question for you is how can South LA come together and support each other right now? I know you've been hashtagging South LA Strong. What can we do as a community right now?
Well, I think it's very important that folks stay connected, that they implement their best ingenuity for how to connect with people, how to help people, and how to be of service to each other. So whether that means, you know, again, just having a phone tree in your neighborhood and building up that phone tree in a way that it's regular and people check in on each other, or you make art during this time period. Whatever it is, don't feel like it's just an opportunity to jump on the couch and do nothing. Like, we've got to do things that benefit ourselves and then benefit each other. Absolutely.
And I think that especially for the entrepreneurs, the business owners, the gig workers, you know, for somebody that not only that's what I do, but that's what I teach. I really want people to understand that this is the hard truth. What you may have done before is not necessarily what you're going to be doing moving forward. So in some way, this period of time is also a time of deep reflection and reinvention, where what I have said is, you know, I always tell people when they start businesses, do something where there's a great need and you also have a great deep purpose and passion behind it. Pick something that you would do every day, regardless of getting paid, because you feel so called to serve your community this way. And so right now, you may not be able to get paid for what it is that you're called to do, but you may have a calling that is boiling up in your soul right now because of, like I said, this emergency situation we're in, I'm feeling is bringing forth great innovation, great inspiration. And we need everybody in our community basically to be bringing the best of what they have, the most innovative ideas that they have, the most collaborative ideas that they have, and finding ways for us all to weave that together, even if it's remotely from our homes.
That's exactly right. You're right on point. I'm so appreciative that you all are there in the space, in the ether, and helping add to the mix that is South LA Strong.
Absolutely. And with that being said, if people want to find out what's happening with you guys, I know your Instagram page. I'm loving your Instagram page right now. You guys are putting out daily updates, specifically informational updates about policy changes, about resources, about a lot of the stuff that we covered today. Would that be the best place for people to?
That's the best place. Yeah, that's where we get you get the most up-to-date information broken down in simple forms as we can do it on our IG page.
Okay. And also, again, you guys follow us on Instagram also at South LA Cafe. Also, we have our website, southlacafe.com. And we are still hanging in there, and yet we still do need your support. So there's many, many ways that we've put out that you can find to support us. If you have it, if you're able in any way, we'd love your support so that we can keep doing what we're doing right now and connecting with these amazing leaders in the community. Thank you so much, Marqueece. This was awesome. I'm so excited.
Thank you. Big fun.
It was big fun. I'm going to stop our call now, but get out there and fight that fight. We're so grateful that you're leading us.
Thank you so much. Keep the faith.
Absolutely.
Bye-bye.